Welcome. My name is Dr. Mary Schroth, and I am the Chief Medical Officer at Cure SMA. This video is part of a series designed to educate the child neurology community, including caregivers, providers, and advocates about spinal muscular atrophy, or SMA. This video is created by the Child Neurology Foundation in collaboration with Cure SMA. These sessions bring together a caregiver and a provider to have a candid conversation and provide their expert advice about SMA. In today's video, we will address what to do when seeking a diagnosis. Joining me are Dr. John Brandsema, neuromuscular section head at the Children's Hospital of Philadelphia, and Dr. Al Friedman, a licensed counseling psychologist and dad to Jack, a young man living with SMA. Welcome, and thanks for joining me today.
Thank you very much, Mary. It's a great pleasure to be here and to talk SMA.
Thank you, Mary. Thank you, John, for including me. It's my privilege to be of support to the community. John, we're interested in hearing about how SMA diagnosis occurs. What type of testing is needed to have a diagnosis of SMA, and which types of specialists are involved in the care of a child and a family affected by SMA?
Well, this landscape has certainly shifted over the past few years. Sometimes when people have symptoms, there's a bit of testing up front that neurologists may consider before they start thinking about a nerve disease specifically. So these would be tests like electromyography or blood tests. But really at the end of the day, the confirmation of SMA is a genetic test that's very sensitive and specific. So the way this is changing nowadays is that because we now have targeted treatments for this disease, we're trying to move the diagnostic time as early as possible for somebody. And this even includes prenatally. So if parents are pregnant, it's now recommended that the parents have testing for whether they're carriers of this disease, because if both mom and dad are carriers of one faulty copies of this SMN1 gene, they have a 1 in 4 chance of their baby being affected by SMA by inheriting both faulty copies in the same baby. If that happens, you can have your baby tested before they're born and know the child has SMA before they're even in the world, which allows us to plan a lot more about what we're going to do related to interventions and treatment and other considerations. Newborn screening is also now in place. In many states, we're now up to about 70% of the American population being born tested for SMA, and hope to be even higher soon as of the time of this taping. In that situation, again, we're looking for both copies of the SMN1 gene to be deleted. In both prenatal and newborn screening, there's about a 5% chance that you'll miss somebody who actually does have SMA, and it's because their reason for having the SMN1 gene not work isn't that it's deleted. It may have some other genetic change in it that makes it not function properly, and so they're missed by these screening tests. And this is why it's still very important to be able to recognize symptoms of SMA and get to a doctor as soon as possible if you're noticing symptoms that are concerning. Can you recall when Jack was initially diagnosed, what you were told about the disease and how that happened?
We never forget the time of diagnosis. It's a long time ago for me, 25 years ago, but I recall a test being done initially that sticking pins in Jack. I think it was an old school EMG test. Mm-hmm. And I remember sitting in a room with the doctors and Jack's mom and looking at the dials as they were examining Jack, and Jack sitting on mom's lap, not very happy with all those pins stuck in him. And from that EMG test result, the doctors strongly suspected and told us about spinal muscular atrophy that very day. And then there was a test that was a blood test. My son was diagnosed at a time when the gene had just been discovered for SMA. So I think he might have been one of the first babies for whom a blood test was given, and that blood test detected the genetic deletion. I still have a one-page report from the hospital documenting that. So it was a two-step process at the time, many, many years ago, and both were important and helpful steps in confirming the and for mom and dad to accept the reality of the diagnosis. And then from there to move on to what do we do to help Jack now that we know he has this problem. So it was a very difficult time, but an important step for us to take and for the doctors to take with us to shepherd us through that process of making a diagnosis.
And I think that's a really important theme to resonate, is that if you have a concern for SMA, get tested. It's a simple blood test, or sometimes even saliva can be used nowadays, and it will confirm the diagnosis. Nowadays, we'll also know your SMN2 copy number, which if you don't have symptoms yet, if you're born with SMA through newborn screening and diagnosed, can tell us something about whether your disease will be more severe or when the likelihood is that you're going to present with symptoms. But we need to get you on treatment as soon as possible. And then once you know you have SMA, once you have that positive test result, get to a specialist in SMA and their care team. This is a really key theme, because once you know you have SMA, you need to know one of our SMA care teams for your life. It's just something about this disease that can't be overemphasized. And we work really hard at our hospital to ensure that all of the different types of doctors that someone with SMA might need are readily available, have expertise in the disease, and all talk to each other so that we do absolutely everything that we can to optimize somebody's life. And I shouldn't just say doctors, it's all of the specialists, whether it be therapists or social workers, genetic counselors, all of the people that are needed to optimize this disease. I know that Jack has had a few different care contexts over his years. Can you speak a little bit about what having a care team has meant for your family, Al?
Our journey began at your hospital, John, and I recall very vividly being introduced first to our pediatric neurologist, and then to a pediatric pulmonologist, to an orthopedist, to a nutritionist, to a social worker, to a nurse practitioner, to a genetic counselor. We had a series of appointments very early on, getting an immersion into SMA and the different aspects of Jack's care that would be so important for us to learn about. It was hard to absorb all the information at the time, but what I recall, even 25 years later, was the kindness and the expertise of the people sitting in the room with us, who stuck with us even after those initial consults and helped us to retain and follow up with the information they provided to us at the time, which was a bit overwhelming. It is when you're in this new situation. For all of you professionals, this SMA is not new, but for every family who comes for the first time, it is new. So it takes us a little time as parents to catch up with you. And 25 years later, I think we've caught up reasonably well, and lucky to have Jack. But the care team is critical to our son's care, and I consider our care team part of our extended family at this point.
And we really want our patients to know that we're all there working together as hard as we can to ensure that somebody has the best possible life with SMA that they can. So with that, I will transition back to Nikki from the Child Neurology Foundation.
Thank you all so much for joining us today and sharing your expertise with the child neurology community. For more resources, check out CNF's website at childneurologyfoundation.org and Cure SMA's website at curesma.org. Together, we are all child neurology.